Good afternoon, and welcome to the first of our spring 2024 housing research seminars. I'm David Luberoff, the Joint Center's Director of Fellowships and Events, and it's my pleasure to welcome you to today's talk, which will feature presentations by our two 2023 Gramlich Fellows, one on collaborative efforts to foster health equity, and the other on using ADUs to create more affordable housing. Before I begin, a couple of housekeeping. This is the first in what will be a very busy series of spring events. We have upcoming talks on the potential and challenges of using manufactured housing to expand home ownership opportunities, on artist-led community development initiatives in neighborhoods of color, and on what we can learn from recent studies of homelessness in California. You can find information about these and many other events on our website, and if you've signed up for our emails, they'll be in the emails sent out to you. Today's talk, as I mentioned, features research by the 2023 Gramlich Fellows in Community and Economic Development. And before I introduce our speakers, a word about that fellowship. Since 1999, this fellowship, which is sponsored by NeighborWorks America, has given two graduate students at Harvard, and anywhere from Harvard, a unique opportunity to conduct, publish, and present original research on challenges faced by community-based organizations that are part of the NeighborWorks America network. We're now accepting fellowships applications for the 2024 fellowship. More information on how to apply for this fellowship, as well as information on several other fellowships we offer for Harvard graduate students, and for the first time this year for Harvard undergraduate students, also is available on our webpage. Now on to today's talk. We'll be hearing from two students. The first speaker is Aleks Czulak. Aleks is getting an MPP from the Harvard Kennedy School and an MBA from MIT's Sloan School. She's going to be talking about research she did last summer on how some community-based organizations have supported the development and of sustainable place-based partnerships that are focused on health, equity, and transformational local change. Aleks will speak for about 20 minutes. She'll take questions for about 10 minutes. Feel free to post questions using Zoom's Q&A feature. We will be curating those. Apologies in advance. We may not be able to get to all of your questions, but we will share all of them with the speakers. Our second speaker is Haewon Ma. Haewon is a Master in Design Studies candidate at Harvard's Graduate School of Design, and she's going to be discussing research she did on how community-based organizations are using ADUs, accessible dwelling units, to provide affordable housing. Some really interesting initiatives. Like Aleks, Haewon will speak for about 20 minutes, take questions for about 20 minutes. We'll aim to end at about 1:15 p.m. We might run a couple minutes over because we have two speakers, but certainly no later than 1:20 or 1:25. Videos of this event and slides will be posted early next week. If you need it, closed captioning is enabled, and just click the show captions button. Aleks, it's all yours.
Thank you, David, for the warm introduction. Just going to pull up my screen here. All righty. So today I'm going to discuss local place-based partnerships as a pathway to health equity, and specifically how community-based organizations can serve as backbones or partners to increase local coordination, expand local system capacity, and improve local health outcomes. And a little bit behind both the passion and why I was so interested in this work and getting to spend the summer to learn more about it is that, I do have a passion and interest in building healthy and safe communities by using a multi-sector approach and thinking about how we bridge sectors and community-based organizations and residents together to work on collective visions for local communities. And one key thing that came out of this summer's research is that there really is no cookie cutter approach when we think about local place-based partnerships, whether it's the backbone organization, how partners come together. And there are so many different models of how to approach local partnerships and who that coordinating entity is, whether it's an anchor institution like a university or hospital, or maybe driven by federal or state funding opportunities. But it does raise important questions about who is committed to the place, why, and their capacity for the work. In addition, just to share some background on research on why this is important, Areas and communities with multi-sector networks and partnerships can lead to improved system capacity, which then can also lead to improved local health outcomes. Not all areas may have the robustness and resources that may require for local partnerships. And what's really exciting and what my research shows is that local community-based organizations can help serve in that role as a backbone lead to build local system capital, which can then help improve the health and well-being at the local and place-based level. A bit of an overview of the research. So the question that I focused on this summer is what can be learned from the experiences of community-based organizations that have leveraged partnerships to create healthy and equitable communities? And a bit in terms of today's discussion, I'll share a little bit more about some of the existing models and a couple of themes for successful practices that came up throughout the research. In terms of the research and methodology, the research and reports and interviews with experts focused on collective impact and partnerships on health, equity, community development, and across those different areas. And what was really exciting is then I got to go interview and do site visits with leaders and staff from the NeighborWorks network and other local community-based organizations. On the right-hand side, you'll see 8 organizations that I was able to interview, 6 of which I got to go visit, and really spanning all across the country from Providence, Rhode Island, that was one Neighborhood Builders, one NB, to St. Louis County in Missouri with Beyond Housing, to the West Coast with a couple places in Oakland and San Francisco that I'll share more about. The 4 key themes that came up in terms of successful practices to support the local backbone organizations and partnerships that further health equity are listed on this page here, and I'll go through and do a bit of a deep dive on each one of them, but just to highlight the 4 key themes. The first one is buy-in and action to shift from programmatic to a more holistic approach. And so this is when backbone organizations and partners have that local context and have the ability to have that longer time horizon to build trust. And I'll share a little bit more of what we can talk about, which is comprehensive services not always being that holistic approach, but getting a little bit further in that area. In terms of the second theme of the central importance of physical assets and on-the-ground social services, physical assets could be housing or commercial corridors, and having both of these tied together can help support long-term investments, also show and have some physical structures that community members and partners can see in terms of the development within the area. The third theme is that often the backbone organizations and partners have a strong history of local collaborations, whether it's with local organizations in the area and with government, but there's a rich history in terms of that as well. And when I didn't mention this on the slide that had all those organizations, but one thing that was really exciting there is just the history with those organizations in the local communities where they are. And so that can include when they were founded, all of them have been there for over 20 to over 40 years. And the executive director tenure has also been quite stable for many of them, or having folks who've been grown up in that organization and leading that organization going forward as well, which is exciting to see. And then just the last theme that we'll discuss today is this ability to adapt, experiment, and innovate, and the local community-based organizations really being able to do that in really exciting ways as well. To start with a deep dive for the first theme in terms of just the buy-in and action to shift from a more programmatic to a more holistic approach. I'll just share that this is, I think, one of the hardest themes, both to talk about and to when I was discussing with organizations, because I have found that some of the organizations that think they are doing a more holistic or transformative or collective approach are actually doing something a bit different. And how it's come up in some of the interviews and in research is that they may have many services and offerings. However, some of the challenges they may share include we have challenges in engaging or getting regular engagement from our partners or from residents, which may be a sign that that model going from comprehensive services or comprehensive programs to a more holistic, transformative approach may not be there just yet. It's working on that shift. And then other things I would just highlight here to consider is that in different sectors and areas, we may call some of this transformative or transformative community development or holistic approach as social determinants of health or creating vital conditions so that all people can thrive. There's a lot of really great research and work being done with local community-based organizations, research entities, and others, but sometimes the language can also differ as we discuss these. And just to highlight a couple of stories and examples here. And so I know I mentioned this earlier, but backbone organizations and partners with local context can have that longer term time horizon, which with this shift of going from a programmatic to a more holistic approach can help build that trust and make progress for both the community and the partnership. And I like to have this one sentence that's been really sticking with me, which is sometimes that means an affordable housing developer can become a partner and a creator of summer and school programs and vice versa. And one example in particular that comes to mind is Meta, which is the Mission Economic Development Agency in the Mission District of San Francisco. And their work has been evolving just even over the last 20 years, from starting off with more financial literacy and helping people file their taxes, to doing more work with the Promise neighborhood, which is an approach of convening partners and thinking about the local education and child outcomes. And now they're doing more within housing work. And it's really exciting to see how that approach and both from moving from that programmatic approach to a more holistic approach in terms of the work they're doing, as well as the funding and coordination efforts that they have on the ground. The second theme to highlight is the central importance of physical assets and on-the-ground social services. And in particular here, physical structures in these investments can help instill local commitment and trust. And so with these physical structures and visual changes in a community, whether it's affordable housing or some local commercial development, it can be quite critical to help build that trust in the community, as well as thinking about how that partnership may then continue to work together and have that longer term time horizon, because a lot of these developments take time. And so with that, these physical assets are also building trust, reputation, and critical community infrastructure. And just to highlight two examples that I was able to visit and see firsthand, on the left-hand side, we have Beyond Housing in East St. Louis, so St. Louis County, and in the Pagedale community. And in addition to their housing portfolio, Beyond Housing has a commercial area, which you see the theater, 24/1 cinema on the screen, but the commercial area also includes this theater, the behavioral health clinic, a food hall and business incubator just across the street, which also helps bring in local folks who want to start businesses and help think about where and just be able to incubate within that space. It was just such an incredible place to see. And then even just a few blocks away, there's a summer camp and building to support kids, which is all under the work that they're doing. And so it's building off that last theme of thinking about that transformative and more holistic approach, and thinking about what this type of commercial corridor can look like beyond just what may be offered, but really thinking about even this theater, for example. I don't know about everyone on this call, but I haven't gone to a theater that's the ticket has costed less than $10 in quite some time, but the tickets are reasonable, $5 tickets for kids, and really thinking about how that physical structure can also support social services, but other community aspects as well, which is exciting to see that coordination and connection between those different places. On the right-hand side, we have Fruitvale Village, which is part of the Transit Village out in Oakland and led by the Unity Council. And so in addition to what you can kind of see on the screen here, there are businesses, offices, and apartments. And it also includes a public library, a medical and children's clinic, and schools and services, which serves folks from across ages. And this includes Head Start, high school, and a senior center. And this is also just another great example of the importance of these types of physical assets that serve communities in more ways than one, and just really thinking about both how to engage different potential partners. So for example, even the clinics and the public library having a role in terms of the partnership work the Unity Council is working on, as well as working with what the community wants to see in the area. And then also coordinating across these different types of partners and helping build that the community development and outreach mechanisms to help support this effort. The third theme around a history of local collaborations, I want to highlight two types of collaborations specifically. And so that's collaborations with local organizations and then with government. And so in particular, the pandemic accelerated more cross-organization collaboration and working with government, both for short and longer term funding and coordination opportunities. And in terms of these backbone organizations that are helping work with the local partnership models, they can help build on both past formal and informal local engagement. And so, for example, the Mission Economic Development Agency with the Mission Promise neighborhood has been expanding their work as a backbone organization and helping think about, the assessment of their own partners, as well as how, are there partners they may be missing or how can they work better together? And so just hearing about this rich history and collaboration of ways of bringing partners together and being able to potentially formalize some of these efforts, but and also bring others in as needed. I do want to highlight a couple challenges that came up in some of the conversations and interviews I had, which even when there is a backbone convener and partners, a part of the partnership, there are still challenges that include competition for limited resources and influence for that partnership or in the local area with other funders and other types of opportunities. There may also be some siloed sectors or areas, whether kind of how I mentioned earlier, differences in terminology or a lack of trust between sectors, or potentially past engagement that wasn't as fruitful. And then this idea around backbone organizations helping convene and bring partners together, but at the same time, still, potentially in some of the models that I was able to study, being hearing from the backbone organization that partners will approach and say, we need your help to help file for this funding opportunity because you have more capacity than we do. And so potentially a misbalance around who and how folks are engaging in the partnership and the role of the backbone, and just really thinking about the resources that the backbone can provide, both for the partnership, but also in supporting things that may not be explicitly within the partnership agreement, but still helping the local organizations in terms of the work across the community as well. And then in terms of the government piece that I'd love to highlight, there's a balance required when and how to engage with government. And a couple of examples that I heard through my interviews is that there is this big component about raising awareness for the important work and coordination that's being done and potentially advocating for policies. The Unity Council that I mentioned earlier, they discussed that they are working on making sure they have staff in place to regularly be aware of what's going on with councils and local officials and helping spread awareness of what the work that they're doing and also thinking a bit more strategically about policies. Similarly, Meta from the Promise Neighborhood has been establishing national efforts to think about how to fund Promise neighborhoods for more than the 5-10-year current grants that are structured and to be a little bit more sustainable. And then another piece around that I found really exciting is Beyond Housing in St. Louis. They convened mayors within the area because the St. Louis County area where they are includes 24 different towns, 23 different towns, and they would convene the mayors on a monthly basis, which hadn't been done before. And so they had started that convening, but now is actually led by two mayors that were chosen by the group, and they meet monthly. They continue to meet monthly, but it continues to raise opportunities for raising awareness of the great work that's being done, as well as thinking about opportunities for collaboration as well. And the last theme that I want to highlight is in terms of the practices for local backbone organizations and partners is this ability to adapt, experiment, and innovate. And as I mentioned earlier, there's no cookie cutter approach to approaching these types of partnerships, both to further health equity and local conditions. And what's really exciting about a partnership model is that it does bring in a longer term time horizon that can help build trust in the community and the partnership, but it can also lead to investments and more innovative tools to serve the community and the partnership. And just to highlight a few in terms of the community and resident-driven approaches to ensure actions are consistent with the visions of both the organizations and then the partnership model they're using. There are tools such as surveys, participatory grant making. One, Neighborhood Builders in Providence had a participatory grant making approach, and they would survey the local residents and community to help determine where that funding would be spent. And then other ways of resident engagement on boards and working groups, which across the organizations I was able to interview, that was pretty consistent in terms of ways to engage and have resident engagement very clearly defined in the governance models. And then the backbone organization and the partnership does have to serve as a bridge or translator for across sectors, whether that's government or other entities that are in the area that may not be as engaged with the partnership, but could be. And there's also new ways of engagement, such as that initial convening of stakeholders or local government officials, and then thinking about how that transition may be from not the partnership leading, but potentially others in the community. And then lastly, in terms of investing in more innovative tools to serve the community, I think that longer time horizon part is quite key. By being able to have a longer time horizon, this can lead to more innovative models for financing or pooling of funds. Or I've also heard from some of the organizations of customer relationship management tools that can be deployed for the backbone, maybe led by the backbone to bring on the partners and help with referrals or other ways to engage with the members of the community and the different partner organizations as well. And so it's really exciting to be able to see and think about how local community-based organizations in this effort and work are really bringing in innovative models here. Lastly, just to bring all this in summary, I just want to recap the 4 key themes of successful practices from local backbone organizations and the partnerships to further health equity. So that was the buy-in and action to shift from a more programmatic to a more holistic approach. And as I mentioned, in terms of what we think about noting that comprehensive services is not always a holistic approach, it may be a part of the journey of getting to that more holistic transformational approach that organizations may be going through. In terms of the central importance of physical assets and on-the-ground social services, physical assets like housing and commercial corridors, which may also have business incubators, and social services driven by community-based organizations can help support these longer-term investments and help build trust, reputation, and critical community infrastructure. And communities with a history of local collaborations and rich collaboration with local organizations and government have a history of working together and are rooted in equity and community development and opportunities to continue that work going forward. And then lastly, the being able to adapt, experiment, and innovate. A longer time horizon can help build trust in the community and also build trust in the partnership to think more long-term than 1, 2, or even 5 years, and thinking more 10 years and beyond. And these practices from the left-hand side can help going back to thinking about local community as well as health outcomes of bridging and coordinating among different sectors. And also bringing together a collective vision for the local community, which helps build system capacity and can make meaningful improvements for community health and well-being so that all community members can thrive. Sharing my contact information. Thank you all for the engagement. Looking forward to questions. And also just want to say a thank you to the Joint Center on Housing Studies and NeighborWorks for this opportunity, the mentorship, the advising, and being able to do this work and being able to learn quite a bit here. And so looking forward to everyone's questions.
Aleks, thank you. I've had the opportunity to spend a fair bit of time with you over the last several months, and you've distilled an extraordinary amount of work down. We're starting to get some really interesting questions. So I'm going to work my way through some of this.
Mhm.
Did you see, there are a couple of different questions about how do you measure success? So, are there consistent patterns, or are there some differences in how people think about whether or not these efforts are working?
It's a really great question. And I would almost, so just to replay it in terms of thinking about outcome and data and measures for this type of work. And I'd say there's, in terms of of 2 themes that are coming up, I'd say the first one is around a lot of long-term generational impacts of disinvestment and just impacts in the community take time. And I think there's this realization both in the funding sphere as well as across organizations that we won't necessarily see outcomes overnight or even within the first year or 2. And I think it sounds like there are grants and structures in place going forward where there's this longer time horizon that's being allowed for, because these generational changes aren't going to occur within even 2, 3, 4, 5 years. So I'd say that there's that first piece. The second theme that I think is coming up, it really varies across the organizations in terms of their data maturity as well as how they're thinking about their reporting. But it does sound like there are opportunities for leveraging research or entities that may help, whether it's universities that are helping provide some of that effort, or existing partnerships or consultants, to be quite honest, that are coming in and helping. And like in terms of specific metrics, I think it really varies across the organizations, but the fact that many of them are expanding and thinking about children outcomes, even if they were started as a housing developer, but really now thinking about whether that's kindergarten readiness, third grade readiness. Those are, I think, some new interesting metrics, especially for community development organizations that started within the housing space.
Could you talk a little bit more and maybe give a couple of examples of the way these collaborations are structured, or if they're not, sort of the informality, and maybe with a particular focus on, are all of the ones you looked at led by community-based, essentially housing organizations, or were there some where somebody else was sort of I guess the term you used was backbone, and the the CBOs were kind of part of that collaborative. And I'll follow up, but just how are some of these structured? I'm going to want to ask you about funding, so we can understand funding, or if funding would be helpful here, you can weave it in.
That sounds great. I will actually start off with the Mission Promise neighborhood. So that's led by the backbone organization Meta, based in the Mission District of San Francisco. And so in terms of what's an interesting model, that they received a Promise grant, so which is a federal grant. So they are the backbone organization, and then there are partners that they work with, which include health clinics, and a law firm and a couple others. And so they help bring this group together. They convene on a regular basis. They also, on their website, actually have this incredible mapping of the partners to see who uses which partner, and just kind of being able to think about, are we using all of our partners effectively? Should we change the way we're managing and operating? So that, I think, is just one example where you'll have the community development or the community development corporation or the backbone organization helping lead that effort, and being able to be that backbone, but also that then raises some questions around, a backbone organization leading versus being a partner versus being a neutral convener in this sense. And I think on that last part around neutral convening, there's likely no neutral convener unless it's an outside consultant in that space, but there are ways you can use that as a tool to help bring in more of an equal playing field for that, for the partnership to continue working together. In terms of the majority of the organizations I interviewed for backbone organizations were all local community-based organizations, which is really exciting. There's others in the research that includes universities or hospitals. There is one one university that came up, which was the Evansville Promise neighborhood. So kind of building off that Meta model, which is how I found them, which they have been applying for the Promise neighborhood grant with, as the university as the main partner, and then with other community-based organizations. And they have an amazing layout in terms of partners involved, like who's a part of this committee, and just they've been working on it for so many years, and they just got the funding announcement last year, which was exciting to see. But that's an example of two different types of backbone organizations kind of leading that effort, but being able to still bring together partners to think about that.
And what was your sense of, or what were some different ways that these collaborative initiatives made decisions about, yes, I'm going to fund this, no, I'm not going to fund that? Sort of, how does that decision get made as best you can?
Yeah, so what was interesting is sometimes there were grant opportunities that they would decide to all apply for, and it really also depended on the grant opportunities. So oftentimes you'll have a lead and then the subcontract model. And so, for example, if you had, for many subcontract models, even across government grants, you may have a limit of 4. And so if you have a partnership model of 8 local organizations, that means someone isn't getting included. And so there may be conversations that would occur in terms of, how do you split that up? Are we applying for this grant together, or is it a subset? But also still keep being in mind and being grounded that this is about the partnership and the local community. And so it may be that we need to do some splitting in this sense, but these are the core partners that are required here. So it really varied in that respect too. And then the other piece I would say on the funding, and this is, for example, Meta leading a lot of the national effort around Promise neighborhood funding. And so it seems like more community-based organizations taking that role, where the grants may be 5 plus an additional 5-year extension, so leading to about 10 years. And there being a push to thinking about more longer term funding and sustainability efforts. And so that's more at the federal level. Some states have health equity zones, but also have that same challenge of that short-term funding model. And so really thinking about how do you push for longer-term funding models also from foundations, but there's been a bit more of a shift with that from both the Ballmer Foundation and others.
Can you give a sense of scale? If you get a promised neighborhood designation, how much money are we talking about? How much money are we? Does it look like for some of these initiatives which weren't promised neighborhoods?
Yep. And the exact number is slipping from my mind.
Rough orders of magnitude.
In terms of it's millions of dollars of investments. And I would just say the promised neighborhoods were started under the Obama administration. And so you've already had like tens of thousands of millions of dollars being distributed across communities and these extensions. And so really just opportunities in that sense. So that's just also one place-based local investment that has been trying to do more of this holistic approach. And there are others that are also, I think, trying to do more of that. So there's millions of dollars that are being spent in terms of how these types of partnerships come together, but also opportunities to think about how they may be structured going forward.
And at least I mean, you were particularly looking for, by some metric, entities that had been working for a while and that people thought were doing a good job. Rough mix of, how much of the funding you were looking at, again, that was promised neighborhoods, other federal sources, foundations, state and local government, something I haven't thought of yet, but.
Yeah, so I'd say of the 6 that I was able to interview, and this is, I'd say there's 2 of those types of designations. So there's the promised neighborhood designations that was Meta, and then One Neighborhood Builders in Rhode Island had funding from the health equity zone from the state. So that's 2 more government sources of funding to support the backbone. And the remaining had a lot more focused on foundations or other types of grants that help support it. So that hopefully gives a little bit of a picture that the vast majority were funded and through federally or state designated ways to support a backbone organization and the partnership model there.
Was there any difference in your mind, between the entities that were sort of funded out of a federal initiative that, sort of looked for collaboration in some of these foundation initiatives, or?
That's a great question. I think in terms of the differences of funding sources, and I should actually clarify one piece. So I know I said Meta got promised neighborhood funding, but they've also, there's also plenty of other sources of funding in that respect from foundations and also more place-based investments related to foundation grants. But I would say the one that comes to my mind in particular is Beyond Housing in St. Louis is working currently, they're raising a fund to be able to think about longer term investments. And I can't remember the exact numbers, but they're trying to get millions of dollars to think about longer term investments. And that includes getting funding from private businesses, foundations, and others to think about this fund that's a longer term for this area. So it's not like you're trying to raise money every single year, you still are, but like being able to have that more commitment and investment in that respect.
Last question, which is just a marvelous question. There is a high school student listening in, there's a class listening, who asks the following: how do you train or convince people to care enough to be holistic? Holisticity takes kindness, patience, and care, and a big concern with current organizations is a lack of these qualities, participants. So I don't know if you have the answer. I would really, but it's a wonderful question. I think broadly, it's also, I think, a fascinating question about how do you convince an organization doing a particular thing that they should spend their energy on collaboration. And we both smiled when we came across this question. I don't know if you have any thoughts on that as a wrap here.
So I have 2 immediate thoughts that come to mind. The first one's just going to be kind of resources that exist, and the second one maybe will be a bit more in terms of my own personal experience and hopefully some inspiration in that sense. But there's a lot of really great networks that are existing over the last couple of years in particular to help bring leaders across organizations to help start thinking about collective impact, transformative change, more holistic approaches in that sense. And so there's fellowship opportunities, which even my NeighborWorks mentor, Romy Hall, has been a part of a few of them, whether it's, and there's just a lot of opportunities to think about leaders that could engage in this and how they are working on really thinking about also bringing that model to other organizations. I will, the second piece I'll just say is like spot on. It is hard. And even like I had some conversations with organizations that weren't listed on my slide there, where they'll say they're doing transformational change or holistic approaches. And you kind of hear then, oh, but we're not getting that level of engagement from folks, or we keep hosting these events and folks aren't engaging. That just might mean we're not actually have shifted into that approach, and we need to go back to the basics. And some of the things that I got to hear and see while I was on the ground is that means really holding focus group, holding spaces of community building, and being able to bring folks to help share ideas. Or even, I think my favorite example I didn't get to share, but I'll share right now, is one of the largest Dia de los Muertos celebrations is in Oakland, and that's because of the Unity Council and others in the community helping bring that together. And is that a housing development? Is that a organization focused on education? Not explicitly, but it's about community and bringing people together and engaging and bringing folks from all across. And so I just thinking about, not just being in these portfolio areas, but really thinking about the community that and belonging at the end of the day. And that requires a shift and changes. And so whoever asked that question, spot on. And it's exciting to get to hear and see more of that going forward.
Yeah, it's a wonderful reminder. And I love your example at the end about what we're trying. We can get so caught up in the details of the how that we forget the why. And I really appreciate both the question and your bringing it back, and just the importance of community. Well, Aleks, we could talk as we have much over the last year more about this, but our time is limited. A terrific presentation. Aleks will be publishing a longer paper. I should have mentioned this earlier, as will Haewon, summarizing the research sometime this spring. And this presentation and the slides will also be on our website by early next week. So thank you very much. You can take a deep breath now. And it's my pleasure to introduce Haewon Ma, who, as I mentioned, is an MDes student at the Graduate School of Design, and talking about some really wonderful research that she did on ADUs. Haewon, it's all yours.
Thank you, David, for that introduction, and thank you, Aleks, for a great presentation. So I'll just start screen sharing. All right. So hi, everyone. My name's Haewon, and I'll be presenting today on accessory dwelling units, look at the policy and practice behind this affordable housing strategy. So first, I want to give you some insight into what I've been thinking about lately and begin with 3 key takeaways from my research. So number 1, for ADU programs to become scalable, a combination of financial and legal support has to be in place. And this also includes cultural acceptance of multifamily housing. 2, ADUs are political and sometimes contentious. And 3, ADU design is an important piece of creating and sustaining a successful ADU program, but in my research is largely not discussed. I want us to dwell a little bit on the role of designers within the affordable housing advocacy space, especially as it pertains to ADUs, and question how designers can become more involved in the advocacy process. So now I'll jump into some background. This presentation will be organized into the following sections. First, context and history on ADUs and nonprofit-led ADU programs, my initial research questions, the case studies from the different orgs and initiatives I studied this summer, and finally, findings from this research that I'm currently developing into a report. Accessory dwelling units, or ADUs, are becoming an increasingly popular strategy for creating more housing stock. And they were especially popular during the pandemic, when they were commonly used to house adult children returning home and aging parents. Before jumping into the weeds, I want to make sure that we're all on the same page when I say ADU. ADUs go by many names, as you can see on the screen, and given this, there's sometimes confusion about what they are in the first place. So let's go through some definitions. For many of the examples that I'll be talking about in this presentation, I'll be using the AARP's definition of an ADU, which is a small residence that shares a single family lot with a larger primary dwelling. So essentially, ADUs are their own independent living space that have their own kitchen, bathroom, and sleeping area. And you might see the following ADUs in suburban or urban areas that typically have larger lot sizes and were zoned for single-family housing. Some things to notice are that there are detached and attached structures, and there are also different types of interior ADUs. In higher density areas like cities, you'll see these types of ADUs. They're all interior, and they're often in the basement or attic or within existing floors. And they're also not on single family lots. So this is a slight departure from the previous AARP definition. There are a number of reasons why people might want to use ADUs, like housing a caregiver or relative, helping an older adult age in place, or providing a homeowner with rental income. And we'll see examples for each of these in the next few slides. And though ADUs have become increasingly popular in recent years, especially during the pandemic, they're not a new phenomenon. In fact, Fonzie from Happy Days and both Uncle Jesse and Aunt Becky in Full House lived in an ADU. But despite their appearance in popular media, ADUs haven't always been welcome in the US. They became increasingly unpopular after World War II during the development of suburbs and single-family zoning. And a lot of the political contention today surrounding ADUs emerges from this. A 2020 study found that there are 1.4 million ADUs in the US dating back to 1997, but this figure is likely underrepresented because there's no uniform method to track ADUs. A big reason for this is because homeowners sometimes forgo obtaining permits for ADUs, which means that there are a significant number of unpermitted or illegal ADUs that can't be tracked. This study also found that illegal ADUs are often more prevalent in neighborhoods that lack affordable housing. I want to note that there are, of course, also many ADUs that are being used to provide affordable housing that are legal units and have secured permits. But this tension between unpermitted and permitted ADUs is something that came up a lot in my research. So just to situate my research, the link between ADUs and affordable housing has been increasingly studied. Some have argued that they can increase housing supply in a given area, which can then help lower rents. They can also be rented out at comparatively lower rates than other types of apartments. ADUs also benefit homeowners, especially older homeowners, by providing additional income, and that can go towards financing repairs or paying off property taxes. So given this, nonprofit and community-based orgs have begun using ADUs as a tool for affordable housing. When I began my research, I was curious about how these orgs are doing this, how ADUs are being adapted to serve different needs and populations, and what types of challenges they're facing when rolling out ADU initiatives. Through the help of a NeighborWorks program manager, Elena, I was able to identify the following orgs doing ADU work within the NeighborWorks network. Of these, 11 reported developing ADUs. And if we look at the figures from those 11 more closely, you'll notice that many of these programs are relatively new. So that might address why the numbers are still pretty low. The program that developed the most ADUs is the Mission Economic Development Agency towards the middle, and they did 6 ADUs. And when we take a step back and examine nonprofit-led ADU programs across the country, so beyond the NeighborWorks network, we notice a similar trend. There are significantly more programs launched after 2015, potentially because of increasing housing prices and more flexible ADU legislation being passed across the country. So to further investigate nonprofit-led ADU work, I read existing literature, did 23 interviews, and was able to go on 2 site visits, one in Scranton, Pennsylvania, and the other in New York City. From there, I connected with the following organizations and learned about their ADU programs, which I'll briefly describe now. And to just provide a general timeline of these programs, the base campaign headed by Chaya CDC in Queens started in 2006, and the rest of the programs began in 2019 or later. I also want to note that ADUs are more commonly associated with the West Coast, like states such as California or Oregon. And it's true that there are more allowances for ADUs there. probably because there's more cultural acceptance of them. But examining these newer initiatives on the East Coast is important to understand challenges specific to organizations who might be dealing with more restrictive ADU policies. Now, I'm going to spend a few minutes providing some background on these programs. I won't be able to get into everything, so please feel free to ask me questions during the Q&A at the end. So starting with the Elder Cottage Housing Opportunity, or ECHO program in Pennsylvania. This particular program was spearheaded by the Pennsylvania Department of Aging and the Pennsylvania Association of Area Agencies on Aging. So it's a state program working with a local nonprofit, and it's granted NeighborWorks Northeastern Pennsylvania. So this diagram illustrates how the program operates. First, an older adult might find living at home challenging and consider moving to the home of an adult child or caregiver. The ECHO program would allow for the older adult to have a separate living space in the back or front yard of the adult child or caregiver's house. The nonprofit owns the ECHO unit, which is rented out to the older adult. The nonprofit would also obtain a permit and place it on site. The ECHO unit is considered a temporary residence and would eventually be removed by the CBO once it's no longer needed. And then that unit could be moved to another residence. So there are a few restrictions to applying, which include age, income, and the ability to pay rent. And the CBO essentially acts as a property manager within this program. NeighborWorks Northeastern Pennsylvania worked with various partners to design these units, and these include college students from Johnson College who designed the ADUs to be accessible for older people, and Simplex, a mobile home manufacturer. Now, the next two initiatives will focus on the intersection between advocacy for ADUs and built projects. Here, my research shifts towards how CBOs are addressing illegal or unpermitted ADUs, which serve as informal housing in dense urban areas. The BASE campaign began in Queens, New York, as a collaborative effort among CBOs and advocacy groups like Chaya CDC. Like their name suggests, they focus on basement apartments. So in 2009, they published a report that examined New York City's basement apartments, and they wrote about the risks posed to living in these units. They also found that tenants were often recent immigrants who couldn't afford other types of housing. In subsequent years, Chaya CDC strongly advocated for a pilot program that could convert these units into safe, legal apartments for existing and new tenants. And in 2019, they secured $12 million in funding to do this from the City of New York. Unfortunately, during this process, they found that only 5 of 102 properties assessed were eligible for conversions. And in 2020, the program was defunded during the pandemic. And then in 2021, Hurricane Ida hit New York City, and 11 people living in basement apartments died. So that same year, Chaya CDC published another report examining basement apartments and found that the majority of these units are in BIPOC communities in Brooklyn and Queens. And since then, Chaya CDC and other groups have started to shift their focus to advocating for more flexible ADU laws on the state and local levels. There are currently 376,478 basement and cellar apartments in New York City, but this figure is also underrepresented for reasons that I described earlier. And since then, Chaya CDC has been considering how they can adapt their strategy so that they can have more buy-in when they are trying to advocate for these flexible ADU laws. So one potential strategy has been targeting older adults who are homeowners who might be looking for ways to make additional income given the pressures of gentrification in the area. And they've been looking at different community spaces where they could find these older adults and talk to them about it. Other organizations in New York City are also advocating for ADU legalization, like Asian Americans for Equality, which is based in Manhattan's Chinatown and Flushing, Queens. And this org is part of the New York ADU Legalization Coalition, which supports flexible ADU laws. And Asian Americans for Equality, or AFE, doesn't own or manage ADUs, but they've encountered situations where homeowners or government agencies will approach them about an illegal ADU and ask them for some creative strategies on how they can deal with it. A director at AFE told me that most people living in ADUs don't want to advertise this fact. And so they often get involved when there's a problem. And they've also found some illegal ADUs while acquiring tenement buildings. And in these situations, they first inform the tenant that the ADU is unsafe to inhabit, and then they try to relocate them to an existing vacancy within their own real estate portfolio. And finally, the +1 ADU program is a new ADU initiative based in the state of New York. There are 8 different community-based orgs involved in this program, and 3 are NeighborWorks network groups. In 2022, the New York State capital budget made $85 million available to create and upgrade ADUs across the state as part of a 5-year housing plan. So this program is part of that. And the CBO's responsibilities are divided into 3 categories: pre-development, construction oversight, and post-construction monitoring. And there are some requirements for participation, such as income. There are some income restrictions. So now that I've gone over the background on these programs, I want to share some initial findings. There are a few hurdles in developing ADUs that are shared among the initiatives. ADU literacy is one of them. Second is financing, and the last is navigating rules and regulations related to ADUs. So starting with ADU literacy, knowledge about ADUs can be difficult to access, but CBOs have been using various strategies to educate their communities about this type of affordable housing. The BASE campaign in particular has been especially active in helping homeowners understand different policies that might impact existing ADUs. They've been vocal at rallies related to ADU bills, and during their 2019 program, they contacted all eligible homeowners directly to notify them of the program and ask if they wanted to opt in. They've also collaborated with a number of other advocacy groups to create booklets that can be accessed online for free that summarize local ADU laws and simplify the conversion process for homeowners. And in cases where the ADU is an external structure, like in Scranton, there are often concerns among community members about how the look of an ADU might impact the neighborhood. So NeighborWorks Northeastern Pennsylvania organized a press event last summer at their ADU manufacturer's warehouse, and they invited community members to tour the newly constructed units. And a final challenge in having ADUs is navigating owner and tenant relations, especially when the units are unpermitted. The BASE campaign and AFI both have addressed this as part of the work that they do related to basement conversions. Chaya CDC especially has described how difficult it is for tenants to publicly speak about living in these apartments for fear of eviction. And even in situations where the ADU is legal, like in the ECHO program, certain situations might arise when the older adult requires additional help that goes beyond what the host family can provide. In a situation like this, the CBO partners with an agency that can provide additional care and supportive services. So in this chart, we can quickly compare the 4 different ADU programs, and each of these uses, types of ADUs, and existing housing types requires a different workflow process for community-based organizations. But it's also important to note that this requires communicating the intent of the program a little differently to interested participants, so everyone's on the same page. And every program I studied addresses unpermitted ADUs, though using different approaches. The first approach is through legalizing ADUs, either through advocating for new ADU laws or upgrading existing units and making them code compliant. And the other approach is that the CBO owns all new ADUs and acquires permits for these themselves. So that is what NeighborWorks Northeastern Pennsylvania does. One reason why rules and regulations around ADUs can get so confusing is because only 10 states have passed statewide ADU legislation, which just permits them by right. And so that means that when there isn't statewide ADU laws, obtaining permits for these structures is based on local zoning laws, and that can be difficult for homeowners to navigate, especially if they don't have any knowledge of them. And in these programs, we see 2 different entities who handle the permitting and zoning. In the BASE campaign and +1 ADU program, it's the homeowner's responsibility to ensure the permits. And for the ECHO program, the CBO handles permitting and zoning. Then finally, moving on to financing, most of these programs are funded by state and local government agencies. And I just want to share one anecdote related to this. So if you can see on the left around how much funding each organization received for their ADU program. during the basement conversion pilot program in New York City, so the BASE campaign, advocacy orgs found that the amount offered wasn't enough to cover most conversions, which required at least 250 to 310K. So if you compare that with the 120K they did receive, that's less than half of the required amount. So this calls into question whether new ADU programs will run into similar challenges when they actually start constructing these ADUs and find that they need a lot more money than they initially thought they would. There are also different program models and their ownership models differ. So this aspect of the ADU program is also important to communicate to interested homeowners because it impacts how they navigate different rules and regulations, like permits and their financing options. So I just want to revisit the key points we saw earlier in the presentation. First, for ADU programs to become scalable, there needs to be a combination of financial and legal support for them, which includes cultural acceptance of multifamily housing. And we've seen that in each of these case studies. Second, ADUs are political and can often be met with contention, as we saw in the New York examples. And lastly, ADU design is an important piece of creating and sustaining a successful ADU program. And this is especially true for basement apartments and for ADUs designed for aging in place. So what follows from this? A potential ADU strategy that I've been thinking about is if CBOs nested a pilot program for ADUs within broader repair programs. So this is actually pretty similar to a model that Asian Americans for Equality uses, where they have an existing repair program that addresses aging in place and general maintenance, but they also occasionally help homeowners who have accessory dwelling units and try to get them to the right people who can help them convert them into a legal unit. So something like that gives the CDO the ability to do the following. One is assess need, potential, and willingness. It also helps them pick a mission, which was an important takeaway from many of my conversations this summer. A major note that emerged during interviews was that ADU programs need a clear marketing strategy because they're so diverse, and that can get really confusing. So being specific is helpful for participants, CDOs, and partners, and deciding on an approach upfront saves time and energy later on. And it also helps with assessing potential challenges. So these could include challenges that emerge from the building stock or building code, but they could also relate to cultural and political attitudes towards ADUs, which relate to financial support. So having a small scale ADU pilot program within an existing repair program might help just identify what kinds of challenges might emerge if you wanted to scale that up one day. And then lastly, cultivating a team of partners and contacts is really important because you need to find people who can specialize in ADU design, construction, and management. Each ADU is also site-specific and comes with its own challenges. So it's important to know how best to sequence the workflow and who can help with what. And this can also be useful for finding partners to help teach workshops like tenant protection education for homeowners. So thank you so much for listening to my presentation. I also want to thank NeighborWorks and the Joint Center for Housing Studies for all the conversations and support this summer. And I'm sure you have questions for me, but I also have questions for the audience. As I've been writing my report, I have started thinking about a few emerging questions that I'd love to get your opinions on. So those are on the screen. So thank you.
Thank you. And again, just a really interesting overview. And I really appreciated, from when the idea for this emerged almost a year ago, because we don't typically think of community-based organizations being active in this space. And I'm struck, as I think you were, by the relatively small numbers. And I guess I'm wondering, if I'm the head of a community-based organization, I have to make a decision about, where do I put our limited just our time, and these things are hard. Did you run into situations where people said, this would be interesting, but it's too hard to develop the ADU. I'm not sure I want to be overseeing a bunch of scattered site developments, and where folks sort of said, maybe not.
I think I did run into organizations who had that mentality, but who were inevitably having to address ADUs because, especially in New York City, because they were unsafe and unpermitted in many situations, and they were being asked to address them anyway. And so I think that for organizations who don't have their own ADU programs like Asian Americans for Equality, but who are having to step in, it was more of a question of how can we communicate to people who are currently living in this type of housing situation that we can try to secure another option for them within our own building portfolio and get them to safely move out. And then how can we communicate to the homeowner that they can't rent this out to people? And so I think that maybe because it was in a place like New York City, the concerns were a little bit different, where it wasn't as much as we're interested in having ADUs and we want to roll out a program. It was more, okay, these already exist, and how are we going to deal with it? But I think if I had studied more organizations on the West Coast, maybe where there are already laws in place and more of a streamlined process for ADUs, those would have been the concerns where they think like how are we going to allocate our finances and our staff to be able to get a program up and running? Yeah.
No, I thought it was. I mean, I think the typologies and the differences that emerged is a really interesting question about funding. You cited at least one program, which was using public funding. Or did you see any examples of other funding sources, including some form of either conventional or subsidized loans from the private sector, that somehow the CBOs were either tapping themselves or helping homeowners tap?
Right, that's a great question. So I haven't seen any of this. I wasn't able to connect with any of programs doing that currently, but I did have a conversation with Fannie Mae about some loans that they were offering for homeowners to produce ADUs. And I think a big question for that was also what's the best process for developing those partnerships between CBOs and entities that could provide those loans. And I think one question is also, who is your target audience? Because I know that when speaking to some CBOs who are rolling out ADU programs where they were offering some sort of subsidy or financial support, they were targeting low to moderate income homeowners, but they found that it was actually really difficult to be able to finance an ADU project from scratch, because they, as a lot of construction projects do, inevitably would go over budget. And people who are low to moderate income might not have other options, basically, to be able to get to get more money to develop those ADUs. So one director at a CBO wondered, should we actually be incentivizing moderate to high income homeowners to participate in these programs? Because then we might have more of a financial security blanket if it goes over budget. And then there would actually be a unit available for someone to rent out within the proposed timeline. Whereas what they felt like they were doing now is they were starting a bunch of things and then might not be able to finish them. So I wonder if that's a potential avenue for some of these orgs to collaborate with.
I think that's a really interesting point. And one of the things I think that you really highlight in your research is this direction, from the CBO owns it, financed it and owns it to the homeowner and almost everything in between. So could you go out one more? Could you talk a little bit more about, there's some questions about anyone using factory built ADUs. I think the first example was, but what you see both is the potential for factory built ADUs, and you had kind of raised this idea about the role of design, design professionals in this, and could you elaborate on that and whether that may or may not relate to the use of factory built ADUs?
Sure. So in terms of factory built ADUs, I think, one org that I spoke to, NeighborWorks Northeastern Pennsylvania, they work with Simplex, who's actually a mobile home manufacturer, but they've gotten into the ADU space. And I think that works well when you know it's going to be on a lot size that can handle that ADU. But when it's on a more regular site, for example, in the New York City cases, I was curious about when you're doing these renovations, is there a way to make it a little cheaper, basically? What about the kitchen or the bathroom or all of these different things? And the response was kind of like, these houses aren't standardized, everything's really site specific, so you can't really use any type of construction process that is like modular. And so I thought that was interesting. Just when you consider existing housing stock, especially older housing stock, it's really difficult. But when you're thinking about new ADUs, especially detached ones, factory housing is a possibility. Yeah.
And that may play back to your point about the West Coast, that to the extent that places on the West Coast in general are less dense, there may be more space. We have, as is often the case, more questions than time. And I thank folks for the questions, and we will share them with you. I think really interesting research. I think it highlights important themes that have come out in research on ADUs, but I really appreciate the lens of, in your case, what would be the role for community-based organizations in this much larger discourse about ADUs that's going on in so many places. And that's in part for me why the Gramlich Fellowship is so special, is having folks like you and like Aleks, who brought a really interesting health equity lens and very interesting systems perspective to her research, really to bring a set of fresh eyes to longstanding challenges. The goal of the fellowship really has three goals. It hopefully produces something of value for entities in the NeighborWorks network and other community-based groups. I think both of you have done that. Hopefully, it contributes to our knowledge as a research institution about important areas that we need to think about. You both check that box. And then the last is, we really hope to encourage people like you and Aleks to engage with important questions, to care, to go back to that wonderful question from earlier. And it's clear from both of your presentations that you did that. I want to thank you. I want to thank Aleks. I want to thank our friends at NeighborWorks for being true partners in this work, and my colleagues at the Joint Center, particularly Jen Malinsky, who was your mentor in this project. And of course, thank all of you for attending, for posing great questions, for sending along some great resources. I hope to see you online and occasionally in person over the course of the coming semester. Everybody have a great afternoon. Thank you.